and welcome to Government 101. I'm Eileen Preston. One of the perhaps the most critical job of government is to take care of its citizens, and its most vulnerable, its children, is the top priority. That's why we're speaking today with Children's Cove Program Manager and Community Education Director. This is Jacob Stapledon. Jacob, would you, first of all, thank you very much for coming in. Very much appreciate it. And I want you to tell us all about Children's Cove.
Yeah, thank you so much. So Children's Cove, we are the Child Advocacy Center for Cape Cod and the Islands. We're a department of Barnstable County government. And we work collaboratively with investigative agencies, specifically all departments of law enforcement, the Cape and Islands District Attorney's Office, and the Department of Children and Families, which is the child protection agency for the state of Massachusetts. We work collaboratively with them for cases involving crimes against children. Specifically, we deal with cases involving child sexual abuse, severe physical abuse, witness to domestic violence, and what's called commercial sexual exploitation of children, otherwise known as human trafficking.
Okay, big charge. So how long have you existed and where are you located? Do you have other branches? How does it work?
Yeah, so we have been around since 1997. That's when our department opened. We are located in Barnstable in an undisclosed location. Because of the nature of the work we do, we don't publicly list our address. And we do partner with Connect to End Violence on Martha's Vineyard, where we have a kind of a remote site where we can send our interviewers and team to respond directly to Martha's Vineyard if we need to have an interview with a child from Martha's Vineyard.
Okay, so let's delve into the need for children's advocacy. There must be many in the nation, and you are one of them. You're funded completely by the county, right?
Well, our funding comes from a couple of different streams. We are the only county-based child advocacy center in the Commonwealth. About half of our funding comes from the county. The other comes from state and federally funded grants. But we are one of 12 child advocacy centers in the Commonwealth. There's over 950 across the country. So this is a standardized model. We're not like a conglomerate or anything. Each department is individual, but we are a nationally accredited center, which means that every 5 years we go through an accreditation process to ensure that all of our policies, procedures, our practices is up to an evidence-based standard. So everything that we do is based off of an evidence-based standard.
And how many people work at your headquarters, your undisclosed location?
Yeah, currently we have a department made up of 10 individuals, 9 who are hired through the county, 1 who is actually hired through the Department of Public Health. That's our pediatric sexual assault nurse examiner. Okay. So they're hired through the Department of Public Health, but they're assigned to us full time.
Okay, and now as far as the need, I have some statistics here, but I bet you know some statistics that would really scare us, but if you wouldn't mind giving us the statistics on child abuse.
Yeah, so when we talk about these issues, this is why there are more than 950 child advocacy centers in the country, is that in the United States, on average, 1 in 4 girls and 1 in 6 boys will be sexually abused before their 18th birthday. More than 90% of the time, that abuser is somebody that child knows and trusts. About 30 to 40% of the time, it's a family member. And because of that closeness, that complexity, that challenge and understanding of that relationship and what's happened, only 1 in 10 children will ever disclose that abuse in their lifetime. And so, this is something that's tremendously difficult for anyone to talk about, but it's also very confusing for children to be able to come forward. And before Child Advocacy Center model started, which was in the mid to late 80s, on average, child victims would have to talk about their abuse if they did come forward, approximately 8 to 11 times, and talking to about 5 to 8 different individuals. And so this is where the model of child advocacy centers came, is to reduce the amount of time that children have to talk about that and provide that coordinated support for them.
And you're saying that would be to report it. They would have to speak to many different detectives and maybe some court officers and lawyers, the judge. Yeah. It went on and on for them.
Yeah, and
re-traumatizing them, basically,
absolutely.
Right?
And it doesn't necessarily mean anybody was trying to do anything wrong or incorrectly.
Right.
It was
the investigatory process, right? You don't want to
exactly right. Yeah. That investigative process would unfortunately lead to that kind of secondary trauma to that child, having to talk about about that experience over and over and over again. Maybe it's to law enforcement, to a detective, to a nurse, to a mental health professional, all of these separate conversations. And so this led to that child having to talk about it so much in that secondary trauma. But even more than that, and what was found was as children talk about these issues over and over and over again, all these people they're talking with are writing it down.
Yes.
And so maybe through no fault of the child, maybe it's a change in a detail here with what that person was writing down, a different way that the child may have stated it. And so when you have 8 different people all writing down the narrative with their own little changes, what it may seem like is that the child was being inconsistent in their testimony when really it was how that information was documented. So it was identified that not only were these cases not being helpful in that investigative process for children, but it was also not helping with the prosecutorial process. And so child advocacy centers really were born out of a way to provide a more child-friendly, trauma-informed model for investigations and support for that child and maintaining the integrity of cases.
And I just want to repeat what you said and make sure that it really sinks in. You said 1 in 4 girls between the ages of, a
0
baby and 18 have been a victim of sexual abuse.
Or will they have?
That's 25% in a room. That's amazing. And 1 in 6 boys. So it happens almost as often to boys, even though
they disclose it a lot less.
A lot less for a lot of
Different
reasons, right? So that's actually excellent that we're talking about this, because I remember when it was difficult to talk about alcoholism in the family, even cancer, people whispered about it, when I was a kid, they have CA, So when people talk about this, it can only benefit a child, I would think, to be able to say to a teacher, something's going wrong here in my life. So I think that's really an excellent a way to help us all sort of talk about it. So can you talk about a child comes to Children's Cove, how do they get there? And then walk me through what happens with the victim.
Yeah, of course. So typically we need to receive a report from an investigative agency. So that would be coming either from law enforcement or the Department of Children and Families. Either somebody's made a report to police department or there's been an allegation of abuse or neglect that's been filed with the Department of Children and Families. So we'll receive that report from one of our community partners. Sometimes it's also the district attorney's office if it's come through a different channel or whatnot. And so we have an intake team, our direct services team will pick up that information, talk with our MDT, multidisciplinary team partners, and identify, okay, let's take a look at this case. What do we know? How do we know it? But also more importantly is now the time to have the conversation.
Oh, interesting. Okay.
We're a child-first organization. Okay, and with our agreements with our investigative partners, we put the priority of the well-being of the child first. Sometimes we do need to take into consideration public safety or other issues there, but we want to make sure are they ready, willing, and able to come in? What's going to work for their schedule, right? Maybe this was something that it's not emergent. It didn't happen recently. Maybe it happened a year ago, and maybe that child's got a tournament tomorrow, for sports, or they've got their SATs coming up. Maybe scheduling that this week isn't the best idea. So we really want to take a look at all of that, factor in those considerations, and then make a plan with that family, the non-offending parent, caregiver, to identify, okay, is now the time for them to come in. Once we have established that time, when we coordinate with investigative partners, so law enforcement, child protection, prosecution, and our internal team, that's when we'll schedule a date and a time. Usually about half an hour or so before the family will arrive, our multidisciplinary team will arrive, and we'll coordinate in a very separate area. One of the things that we want to make sure that we're not doing is overwhelming anybody coming to our location, and seeing a whole room of investigators.
A team of 6 people looking at you.
That would be quite a bit.
For a
so instead, when that child, that non-offending family member comes, that's when one of our team members, typically our clinical program manager, Kathy Fairberg, will answer the door, greet them. We look just like a house, and we're set up just like a house. We have a living room and a kitchen and everything. We'll check in and, what are those immediate needs that they may have? Do they need any water, coffee, a snack, what that may be. And then we'll bring them downstairs to our waiting area and just kind of talk about the process for the day. having a conversation, answering any questions they have. And then whoever is going to be that investigator, our forensic interviewer, will come down and introduce them. Now, the reason why we're utilized in this way is that, one, we are a child-friendly, safe, neutral environment, right? In a confidential location, so that kind of privacy and confidentiality is held. But also, our forensic interviewers are specifically trained on how to have these conversations, okay? It's a specialty. And when you have to differentiate a conversation between, say, a 7-year-old about these issues and a 17-year-old, your conversation is going to be different. The way you ask these questions are going to be different. You know, instances in thinking about time, right? You know, could you tell me what time it was?
Right.
Well, maybe a 17-year-old was paying attention. They have a watch, or they were looking at their phone. 7-year-old probably not. Right? So the way you have that conversation is going to be different. So our forensic interviewers are going to, you know, kind of meet with them, introduce themselves, talk about what the process is with that child, non-offending parent, family member. And then when everybody's ready, then the forensic interviewer will have that conversation with the child one-on-one.
One-on-one.
It is observed by the multidisciplinary team. We have 2 ways to do that. There's a one-way mirror in the room currently, but we also have closed-circuit cameras. These interviews are recorded because it's a forensic interview. It's a part of discovery for an investigation. And we have another area where the MDT members can observe that. But all of those individuals that are in that multidisciplinary team are individuals who would otherwise have to have a conversation with that child. And so we want to make sure that we're getting the questions answered that are needed, but in a non-leading and investigative way. So there's no leading questions. It's really letting that child do the majority of the talking, clarifying any questions, getting the information needed. You know, did this happen one time or more than one time? Was it on top of the clothes, under the clothes, inside the body, outside the body? Did they say anything to you? How did you get to that location? You know, please tell me more about that. And so I think a lot of times there's a misconception that we offer that this is a therapeutic service, and it's not. It's investigative.
Right.
But it is therapeutic in the fact that no matter what that child says, our response is going to be, okay, tell me more about that. No judgment.
Nice.
No shock.
So important.
You know, because that's something that
no shock, no shame. This is
the
I've
shame,
heard this
the
before.
fear.
You can go ahead. Yeah,
exactly. Because you know, when you think about maybe a time you were talking with your parent and you told them something
and they did the head whip.
And they did the head whip and the eyes get big and the what are you talking about, right? It's intimidating, it's scary. And so being able to be there and be present and acknowledge their experience and not be scared of it tends to let people move forward in that conversation. And then if there are any additional questions that the investigative team has, our forensic interviewer wears an earpiece and they have a microphone so they can ask those questions. So again, we're getting all of that information. And then following that interview, this is where a lot of the other work comes into play. Is we'll meet with that parent in a post meeting.
The non-offending parent will meet with you.
We'll meet with that team. Everybody will talk about their roles and how they can support that child, support that non-offending family.
Oh, that's excellent.
But then this is where we'll kind of take a look at what are those next steps and offer services. We have, as I mentioned, a pediatric sexual assault nurse examiner and a medical suite on site. So we can offer a non-invasive physical wellness exam or a sexual assault nurse exam if indicated. We have a clinical program manager, and we work with mental health partners in the community, so we can make targeted mental health referrals out in the community, based on where that person lives. We may be located in Barnstable, but we serve families from Falmouth, from Orleans, from
the Vineyard,
from Truro, from the Vineyard. They're not coming to Barnstable for therapy, right? But let's make a referral that's close to them based upon their specific needs.
And I'm thinking that the parent is also going to need therapy, right? Because you've got this. Even if you're the most completely cool person, you're still your child's just been victimized, you need help, right? And then there might be other issues too. I'm thinking of maybe a restraining order against, let's say the stepfather. Maybe there's court you have to be walked through. You need victim advocate sort of things.
Yes.
Is this branching out? Maybe siblings are involved, right? I don't know. So there must be a lot of different partners and areas you're working in.
Yes, and these cases every single case is unique. Every individual that comes through has different needs, different supports, and And so we will be there to match what those are. We have a lot of community partners we work with, and we want to identify, okay, so let's use that example. Maybe it was the stepfather, but maybe he was also the breadwinner of the home.
Exactly. Yeah.
Right? And now there might be financials that are impacted.
Maybe housing issues.
What about housing, right?
Yeah.
So we'll work to get them connected to the supports and services, resources, and organizations that are there to help with that. To identify, look, maybe they need some meal support right now. Maybe they need some help with resume building. Maybe there's some emergency rent support that's out there. We work with community-based organizations that are there to help and support that. We work very closely with the district attorney's office, so they have victim advocates, witness advocates there. Different departments of law enforcement have victim advocates as a part of their process as well, so it may be appropriate for them to do that. Maybe there's instances of domestic violence in the home as well.
Right.
We work closely with Independence House, A Safe Place on Nantucket, Connect to End Violence on Martha's Vineyard. It's about those relationships and connections and how we are serving one another as a community to really support these children and their non-offending families.
How many did you serve in the last fiscal year, if that's the way you count it?
Yes, so because we are a county government-based organization,
Right.
we operate off of fiscal. So for the current data, so that's from July 1st of 2022 to June 30th of 2023, we served a little more than 200 families. And for specific investigative practices, so the forensic interview, a little more than 150.
And when we hear forensic, we shouldn't just think that's a physical exam. That might be the forensic, just interviewing the child for a prosecution.
Yeah, it's for that investigative process because, and that's really a large component of what it is that we do is having that interview. And, I want to make sure that we clarify is when we're having that interview, it's to ascertain what did or did not happen. It's an investigation. And sometimes maybe there was information which was misunderstood by an adult who made a report. And we're clarifying the facts around that. Sometimes a child makes a disclosure of some type of abuse. Sometimes they don't. Sometimes there was a clarification of something which was misunderstood and we're there. So this is about truly understanding what it was that child's experience and how do we support them and what are the next steps that child and non-offending family want to make. And because again, if we only took into account the investigation, right, our need to know, and not the well-being of the child, then we're missing that opportunity for healing and support.
And quite frankly, sometimes they can be reoffending because they themselves were victims. So it's good to catch this and try to help people, right? Before a generation continues the same pattern, right?
It could be something like that. Yeah,
it could sometimes be that. No, obviously not all the time. Your services are free?
Yes, because we're part of the county, there's no charge to any of our services. So that includes direct services and support that we provide, as well as any of our education and training initiatives. It doesn't mean that there may not be costs to services that individuals receive outside of our care.
Okay.
However, we will typically work with families to apply for victims' compensation if it's appropriate to get some of those costs covered.
Okay. So I'm thinking about your role is community engagement and education. So I'm wondering, what do you do besides telling us here? What is your day like? What are you involved in?
Oh boy.
Do you go to the schools?
Yeah. Yeah. So I'm the community engagement education program manager, and so our education and outreach program, education and training program, is really about raising awareness of who we are, what we do, why we do it. So talking about some of the items that we're discussing here,
Yes.
But also to bring awareness and education to youth-serving organizations and community members. How can you look for those signs and symptoms of abuse?
Let's talk about that. Yeah, okay.
How do you recognize them? How do you respond to that? How do you respond to a child that's made a disclosure? We provide that type of education and training for anyone who's working with a child. So schools, summer camps, recreation programs, early education and care centers, wherever that may be.
Yeah.
We provide prevention education to organizations. in consultation, looking at policies, programs, trainings, procedures, but also for the community as well. Parents, grandparents raising grandchildren. How do you engage and talk to your children about body safety, about these safety issues? We also work with our multidisciplinary partners to provide high quality training from local or national speakers to really, what are the issues, what are the trends that are coming down the pike, and making sure that they're getting that training as well. And we also provide secondary traumatic stress training to partners who are working on this to, recognize the fact that, hey, we get impacted by this work, and how do we manage that in a way that is healthy, and that we can continue to do this much needed work.
So can you speak a little bit more about that secondary trauma helping? So are you helping maybe prosecutors who are handling these kinds of stories, or?
Yeah, I mean, we'll provide training for anyone who works in a challenging environment, law enforcement, first responders, prosecution, really to identify, what is vicarious trauma, what is secondary traumatic stress. How does that manifest itself?
Kind of a new field.
What does it look like?
Right?
Yeah, I think it's something that it's been around, but we just haven't named it, and it's there, and also, very much like talking about child sexual abuse, we need to
talk about it.
We need to get rid of the stigma of, hey, you get impacted by this.
Yeah.
The things that you see, whether you're in the field or the things that you hear as an interviewer, this stuff is challenging. It's difficult, and we all have that in some way. We all get influenced in some way, and being able to acknowledge it and say, okay, how do I manage this effectively is important.
So I'm wondering if you can talk about the schools, your work in the schools. How do you get kids to sort of talk about it? Because I'm sure this is no surprise to you. Sometimes people will tell their friends things that happen to them, and they'll never tell a parent.
Absolutely.
So what do you tell kids to say when they get told by a friend?
Yeah. So one of our programs that we run is called our Teen Task Force, and so it's the Taking a Stand for Kids program, and we've been into a number of school districts across the community, and it's really to provide youth within schools in a really small focus setting exposure to understanding this work and what these issues are. So they get to meet with our entire team. They come to Children's Cove and take a tour. They get to meet with our multidisciplinary partners in law enforcement, prosecution, child protection, internet crimes against children investigators, and really have these conversations to understand this issue. Because we recognized a number of years ago that yes, especially with high school age youth, if something has happened, they're far more likely to tell a peer than adults who can help. And the biggest challenge with that is that those peers, those friends, feel a moral obligation to hold that secret for them, right? Not breaching that trust. They know that what has happened isn't right, but they feel as though they can't ask for help for that person out of that moral obligation. They don't want to lose their friend. They don't want to be considered untrustworthy. However, the biggest challenge with that is if it's happened once, how do you know it isn't going to happen again? Is your friend still at risk? Right?
Yes.
And
or is someone else at risk?
Or is somebody else at risk?
Yeah.
And this is where we start to talk a lot about, what are the long-term implications of untreated trauma? And when we talk about untreated trauma, we know that it manifests itself in many ways. And, depression, substance misuse, alcohol use, self-harm, psychiatric diagnoses. Untreated trauma has a plethora of ways that it can manifest itself over the lifetime of somebody. And when
they even think it affects genes now, it can
does.
hurt your genes.
Yeah,
this healing has to happen.
Yeah, there's been a lot of research that shows that trauma can be passed down genetically.
Right.
And so when we're talking about this and we're bringing this information forward, this is knowledge that kids don't have, right? Teens don't have. They don't know this, and there's this one element here because it's important to them, right? Peer groups and peer relationships are tremendously important to young adults. And so we need to change the way in which we're addressing this because, look, I can go and give a presentation to a school and I might have an impact with a few, but it is far more meaningful when it's coming from peers.
Yes.
And so that's where we're really trying to push our focus is recruiting and teaching these peer leaders within schools to bring this information forward so they can talk with their friends, where they can talk with their classmates about this, and doing community awareness projects, bringing that information to peers, social media, whatever it may be,
Right.
to bring this forward, because it's going to be far more meaningful hearing it from, let's say, a captain on a sports team than it's going to be from that stranger who's coming into your school.
Well, you're persuading me, Jacob, so I don't know. So I'm thinking, you just mentioned social media, and I am thinking about how human trafficking, I'm thinking about kids in school with nude pictures passed around, maybe possibilities that they're going to hang it over your head later. Do you talk about that with them? And that's not sexual abuse. In that way, I guess maybe you call that sexual exploitation. I mean,
Which is a form of sexual abuse, yeah.
Yeah.
Yeah, we have a child exploitation program coordinator. Her name is Alex Foley. She does a lot of work in getting that information out, panel discussions, giving presentations to schools. It's a part of our Teen Task Force program as well. Yeah, and it's such a major issue.
It's very prevalent.
Yeah,
It's also a crime. So the kid who did it, maybe made a dumb decision, and then they're looking at going to jail, right? Or
Well,
so
I think it's there's a number of ways in which you look at it. I think the biggest piece is that with modern youth culture, this is a part of dating, right? Is these nude photos and all of that kind of stuff. However, what it also is at the same time is what's considered, for the federal definition, child pornography, and from the term that we use is child sexual abuse material. Is that when you have a video, a photo, an image of an individual under the age of 18, that is child sexual abuse material. And what we're seeing, and where some of those challenges are coming in, is when that is being utilized to take advantage of somebody, by asking for more photos, by saying, if you don't do A, B, or C, then I'm going to send this to your family. And this may be a known person, it may be an unknown person, and that's where you're talking about sextortion, sexual exploitation, and this falls under human trafficking statutes. So this isn't just a image, it isn't just a picture, this is something that it falls under human trafficking statutes.
Right.
And when there is something that is maybe a exchange or offer of exchange for those images or whatnot, this is when it's called commercial sexual exploitation.
Okay.
And these types of cases, we are seeing a tremendous increase over the past few years. We've been responding to these
Here on the
cases.
Cape?
On the Cape, yeah.
Okay.
We've been responding to these cases and coordinating these cases and the response to them since 2016. We just had another 50% jump in referrals, for these types of cases on the Cape and Islands. We're definitely seeing an upward trend, and that's not just here on the Cape. This is regionally as well. This is statewide. This is nationwide. And we're seeing a lot more, as a national trend, more young men who are being impacted and affected by this. And it's just such an issue now, that it's so critical that we're talking to our young community members that if they're going to do that, there's a lot of risk,
Yeah.
There's a lot of risk.
Yeah. And so what do you recommend parents do? Is there anything you can suggest for parents?
I think one of the most important things that, as a parent, you can do is start talking about difficult issues early.
Okay.
And I think when we're talking about child sexual abuse, teaching body safety is so important as a parent, and feeling comfortable using difficult language, right? Teaching young children, like, oh, hey, these parts of your body are private, right? So the parts of your body that are covered by a bathing suit are private. Using proper terminology, calling a penis, a vagina, using the right words for that, so that if something happens, that child knows how to communicate it effectively. Not being scared of those words. It may feel uncomfortable, because I'm going to wager that that's probably not how you learned about this information when you were a child, that those conversations didn't happen. It's important to start them, because if you can start having those difficult conversations early, as children grow and they become preteens or tweens or teens, and the conversations are switching to dating and kissing and boys and girls and consent and sex, is you've established a relationship of trust and conversation with that child, so that they know that they can come to you with those difficult questions, as opposed to asking a stranger, looking it up on the internet and finding maybe something that's not exactly what they were looking for.
Yeah. Or a misinformed friend who means well but might just give you bad advice or not really know what to tell you.
Yeah, and so there's a lot of ways in which we can encourage parents to do that, and we have a lot of resources on our website at childrenscove.org that can help you with doing that.
We'll put that down on the screen. Are there new things happening in Children's Cove? It sounds like you're expanding. I'm happy you're getting in referrals in a way, so much more of an increase because it means people are actually coming forward.
Yeah.
But at the same time, it is scary that the numbers are going up, right?
Yeah. So some of the new things we have going on is in the past 3 months, we have actually brought on 2 new staff, which is fantastic. So we have a new community engagement specialist, Anna Colby, so that we're expanding our presence in the community, onboarding more volunteers, and really trying to increase our presence to raise awareness. And then
let's talk about volunteers. So what are your volunteers? What do you need and what are you looking for?
Yeah, so there's I don't know if people really truly realize how large of a community we are. Until you drive from Bourne to Provincetown to go from one meeting into another one, and it takes your whole day. We look for volunteers to really help raise awareness of Children's Cove, who we are, what we do, and how people can reach support. And so this could be simply bringing our awareness posters, materials, brochures, and rack cards out to places in the community. There's lots of doctors' offices and community centers that we need help getting that information out to. Or maybe it's an event that's taking place in town, and we want somebody to be able to table and represent us out there in the community. So we really try to find different opportunities based on individuals' preferences.
That's wonderful. And what a wonderful thing to volunteer for, really.
Absolutely.
You talk about a ripple in a pond that's going to really help people. I have a tough question for you. Say somebody calls you up, they have a question because maybe they suspect something or they're wondering. You're mandated reporters. So would a kid who wanted to call and say, I got these questions about my friend, should they be worried about that? Like, is there someone they can talk to?
Yeah, so anybody who has questions, they have concerns, we absolutely encourage them to call us.
Great.
We have an intake line where you can either leave a message or somebody will pick up directly to just kind of talk through this process. Many times we have parents who they've identified something, heard something, and they're not sure what to do. Let's help walk them through that process and where they need to go. And can we help facilitate a warm handoff where maybe they're meeting with a detective at a local police department to just start that conversation as opposed to going to a window. Talking about those situations that, somebody isn't sure what to do, we can encourage them on where to go. But if somebody doesn't provide that information about themselves, then we might be limited in what we can do. But yeah, we are mandated reporters and we can help with that, facilitate that process if we need to.
But you can take calls and people can call and ask you questions and you're there to
Absolutely.
help.
We want to be accessible to the community because, sometimes people don't know who to call or where to go with these types of difficult conversations or questions, especially if it involves young children. People are scared, and we're here.
Okay, so we're wrapping up, but I'm just wondering, is there anything I haven't covered that you want to talk about?
One other new thing is we actually just hired a new mental health clinician.
Okay.
Her name is Dina Anderson, and one of the pieces that we found over the last couple of years is that access to behavioral health has been really difficult for children on the Cape. The number of providers has gone down, and the wait times to get access to care has increased. And so we have brought on a mental health clinician so that we can provide some of that short-term clinical intervention with cases and children who need that support and service until they get established to a full-time mental health clinician. But also we've seen an uptake in cases where there's not going to be prosecution involved, there's not going to be an arrest made because it's involving children under the age of 12 that might have problematic sexual behavior.
I see.
And so she's going to be specializing in those cases as they're coming on until we really build that capacity out in the community, because we are organizing some training for mental health providers to increase the ability to take these cases on.
Jacob, how do you know when you've done a great day, when you've had a great day? Is there, you personally, do you ever have a moment where you think, this is great, I did something, you know, maybe not great, but I did something really important. Because I think your work is so important. But,
You know, I'll tell you, I had one of those last week
great.
where I was on the phone with another community partner who's in a fantastic role, but they had attended a prevention discussion that I had done probably a year and a half ago, and they remembered something I said, and that it clicked for them, and that was where it made a difference in how to have these conversations. And they told me that they were talking to a family member of theirs who has young children and passing that information along. I think it's hard sometimes when you don't get that immediate feedback, or you don't know whether or not you're making an impact. But I do have a lot of stories where somebody said, I remember what you said and I did that. I did not know what to do with this situation going on with my child, but I knew where to call. Those are the times where I'm saying, okay.
Yeah, I hope you remember
we got
them.
it going.
Yeah, because
Yeah.
it's a hard task to hear these stories, but to think that you actually said something, that's beautiful. Yeah. Nothing could be more important.
Great.
So I want to thank you for coming in. I want to thank you all for tuning in, and join us next time on Government 101. Thank you.